Hi there, in this video I'm going to be showing you how to do a new PRIMM T2 assessment. Now first things first, you want to ensure that the patient has already had their T1, their baseline. Otherwise it makes it a little bit harder and you just want to make sure that you're in order. So if you look at the options here, the baseline is gone because it has been completed here, and the next up from T1 is obviously T2. So we click on the T2, and the clever thing about the system is it pre-populates a lot of the old information. So it will remember the old consultant, it will remember the classification of melanoma they had, the location where they were, and then you just go through the exact same process as the T1, make sure the patients are still eligible, or if they've performed any other of the new paper questionnaires or the new samples. So you can just give them clicks for any reasons not performed. Results, we can add any new blood results if we need to. And then we can then say if there's any disease response, ECOG score, that is fairly similar. And then any adverse effects, you can just type here, the grade, and then the note, and then you can add multiple here, should you wish. The drugs, again, exactly the same as it was before. You can just search for the drug in question, click the best fitting one, and then add all the information. And then if you need to add another antibiotic, for example, you can put another one here. And then once you're happy, again, just like the other one, you click to confirm, and then we'll click pending because we might change some things later. And we click save, and you can see that that is the T1 saved for this patient. So if you go back to the patient, we can see that we've done the T1, and now we've done the T2, and we have the blood samples from the first, and the stool samples for the first one. So that's it. It's really nice and simple, and they get smaller and smaller as you go on, so it should make life a lot easier. Thank you very much.